Good morning. This is Dr. Kaminsky at the Walla Walla Department of Community Health. And today I just want to share with you some information that we received from the Department of Health regarding cases, hospitalizations, and deaths by vaccination status. These reports are available to you on the Department of Health website, and they come out every week or two, and there are multiple reports. So I encourage you to seek out this information and share it with your family and friends. This presentation is a summary of that information. So first of all, I just want to lead off with the statement that the COVID vaccines are a critical tool for us to get out of this pandemic. The data is pretty evident that it does decrease our risk of getting COVID, getting severe illness. It decreases our risk of being hospitalized and even death. The Department of Health does use this nomenclature for determining who is vaccinated and unvaccinated. In general, 2 weeks after you complete a COVID vaccine series, you are considered fully vaccinated. You are unvaccinated if you have not received any doses, and you are partially vaccinated if you have only received one dose or if it has not been a full 2 weeks since your last vaccine. This slide shows that if you are unvaccinated, you are 6 times more likely to get COVID than if you were vaccinated. As we get to the 35 to 64-year-old age group, we see a similar picture that you are 5 times more likely to get COVID if you are unvaccinated. And in the ages 65 and over, you're 4 times more likely to get COVID if you are unvaccinated. And so between February 1 and September 7, 2021, we see that 82.4% of all COVID cases in Washington State were in those who were unvaccinated. Looking at our Walla Walla data from that same time period, we see that 78% of our COVID cases were in those that were unvaccinated. And so if you are unvaccinated, you are more likely to get COVID. With regards to hospitalization, this is in the 12 through 34-year-old age group, and we are seeing that younger people are having to be hospitalized at a much higher rate. This graph shows that in that age group that you're 30 times more likely to be hospitalized if you are unvaccinated, and those that are 12 and older are all eligible for vaccination. Between the ages of 35 and 64, you are 21 times more likely to be hospitalized if you are unvaccinated, and those 65 and over, you are 9 times more likely to be hospitalized if you're unvaccinated. And so in the unvaccinated age group in Washington State, we saw that almost 84% of all hospitalizations were in the unvaccinated group. And so if you're unvaccinated, you're more likely to get hospitalized. In the most recent report from Department of Health, they did not include deaths under the age of 65, but we did receive that information for 65 and over, and this slide shows that if you are unvaccinated and 65 or over, you're 8 times more likely to die than if you're vaccinated. This slide here shows that all COVID deaths 12 and over in the unvaccinated group, 79% of the deaths ages 12 and over were unvaccinated individuals. And so, in summary, if you're unvaccinated, you're more likely to get COVID. If you're unvaccinated, you're more likely to be hospitalized. And if you're unvaccinated, your risk of death from COVID increases as well. And so we are encouraging each of you to protect yourselves and get vaccinated. And also remember the other mitigation measures such as social distancing and masking. Stay safe, be kind to each other, and get vaccinated. Thank you.